Hi everyone, thank you so much for joining another Lead Squared webinar. I am Shibani and I work for the marketing team at Lead Squared. So today it's all about healthcare. We will be discussing patient engagement to experience the path to patient-centered care. Some of the things that we will discuss during this 1 hour session are obviously what has changed in the last few years, maybe more specifically what has changed in the last decade, the adoption of technology, the evolution of teleconsultations. I know several friends of mine don't even go to a doctor anymore. Just saying, but yeah, all of it is done on the phone, and of course, the steps that the government is taking towards digitizing healthcare in India. So, before I introduce the speakers, just a quick note to the audience: we have our speakers here. Feel free to pass your comments, questions, or just say hi on the group. I have our backend team, Avantika and Sneha, who will be helping address any queries you have. With that, let me just quickly say a line or two about our speakers. So we have Siddharth, who is the co-founder of Practo. Hi, Siddharth. Thank you so much for joining us. And
Hi.
we have Nilesh, who is the co-founder of Lead Square. So this is a co-founder exclusive. Please take it away, Nilesh and Siddharth. We're here in the back end if you need anything.
Thank you, Shibani. And Siddharth, again, good to reconnect here after some time. I think we probably, of course, have met, regularly, but post-COVID, I think there's been a bit of a lull since we reconnected. And I so much remember the first meeting we had in Practo's office.
Right.
That was an amazing meeting. It was a good meeting. I remember it, vividly. Um, so I think one thing I'd like to sort of point out as we go in is that I have actually taken several consultations for myself on phone. It was not through any teleconsultation platform. It was more, like an introduction to someone, right? And then I regularly interact with my child's like the doctor, right? And he is also very pro tech, so they interact. So I think the fact that things have moved offline, or rather not in person, is real. Like it happens uh,
Absolutely.
to all of us. So I think that being said, I think the first question really in my mind is, I mean, you have been in this industry for like 15 years, more than
15
15 years.
years now. Practo's just completed 15 years, and we've been through a couple of changes that we've seen the industry go through. And the teleconsultation one that you mentioned, I think the real change came about during COVID. Pre that, it was a small pie of the market, but it's really taken off since 2020.
Yes. COVID was a big boost. So before we go to that important hockey stick event, right? Um, love to learn a little bit about Practo's journey over the last 15 years and your personal observation over 15 years of how healthcare you have seen evolve in places where there have been distinct, step function changes in the way the market operated, right? Love to learn your perspective from your vantage point.
Sure. So thanks so much for having me, Nilesh. Great to connect again. So we've been in the healthcare space for 15 years now, and I think the vision that we started the company was trying to make healthcare simpler for people to access, make it more affordable, and the final goal is to make people live longer and healthier lives. That's the vision with which we come back to office every day and work in this space. So when we started off back in 2008, we were trying to solve the problem of digitizing medical records that a doctor generates. And we realized that there weren't really great tools that they had access to, through which this could potentially happen. So everything was on pen and paper completely. And so we built a SaaS platform. We called it Practo Ray, and then couple of thousand doctors joined that platform over the first few years of our journey. We were a company selling to small to medium sized clinics, got good success back then, and we could see very high degrees of adoption usage by the early adopters. Uh, But what we really saw was for every one guy who would sign up and say, yes, I would want to digitize my practice, my business, there were another 5 to 10 other doctors who would say, okay, this sounds great, but it would be great if technology could come and help me discover on the internet. That was the problem statement that most doctors were telling us. And with that insight, we built our first doctor discovery directory platform, which is Practor.com as you see it right now. So we had those couple of thousand doctors who were using our SaaS platform. We sort of built a directory, searchable directory for patients, where someone could come and say, I'm looking for a dermatologist in Hyderabad. We could give them the options. And because we knew who these guys were, where they were, we also built profiles around what was their education, what was their specialization. So based on that, we could show results to consumers, and then they could find doctor, discover doctor, and book. And that core service is the foundation on which multiple other platforms and products at Tractor have been built. But that continues to be the backbone, I would say, right now. So a couple of million consumers come to us every month and make these healthcare decisions on where should I go for which ailment and which specialization. So that is the primary product. I think we've gone from small single digit appointments a day back in 2013 when we launched this discovery platform. Uh, Today we do a couple of lakh appointments a month. And in that journey, what we've seen is the market has changed along with that. The question that you asked is what step function changes have happened. A lot more doctor discovery searches now start on the internet. People are far more aware, thanks to every other category, where they're given options of choice of catalog, of reviews and ratings for everything else, right? It's come to healthcare as well, though in much smaller numbers, but we've seen a decent movement of consumers doing a much more research decision before they decide where should I go and get my healthcare. And on a spectrum, if I put small ailments like a headache and cold on one side, and the other extreme are maybe terminal diseases where you're looking for a cancer specialist or a cardiovascular surgeon, the degree of research keeps increasing as you go up that spectrum. So the more serious the ailment, the bigger ticket size that the treatment is, the more people research and then decide. But having said that, even right now, our mathematics says the penetration of consumers looking on the internet is sub 2%. So it's less than 2% of all doctor-patient meetings which start on the internet. They may not even complete on the internet. The discovery at least happens on the internet. Some of them may be video, but most of them are still physical. But it's that 2% penetration that digital platforms, all companies in the space put together, have got to. So it's still a quite an underpenetrated category. If I was comparing to, let's say, e-commerce or travel or any other category which is seeing upwards of 10% penetration, we're still quite low, which is a good thing for a business. There is a big opportunity. The markets are changing. So as that grows, us being the dominant player, we have a good chance to make a great business out of this.
This is very interesting and a good summary of what you have seen. And I think it ties into the whole idea of patient experience, because fundamentally you all started with the theme and the mission to say, well, you want to make difference to the lives of the patient, right? And the start and origination of the how it evolves, and and that counts into the experience, which is basically to say. Make the choices available to the patient in terms of who all they can go to, and look at the performance of the doctors or the clinics or the healthcare providers, whoever they those may be, and basically make it available at their fingertips, right? Which kind of huge difference in patient experience versus what they are accustomed to, before that, right? So I think that's a huge leg up. Now, you did mention one big change, which so there is a pre-COVID and there is a post-COVID, right? Which was a huge healthcare event, which transformed many industries, right?
Right.
So what change that brought in
Right.
in the business model,
Sure.
and what has that resulted in a certain change in expectation, which will also mean
Sure.
that the expectation around experience will change for the patients, right? So if you can give some background on that, that'll be very helpful.
Sure. I think the consumer intent itself of trying to uh, get healthcare options on the internet, that changed completely because it was a forced function. People were in a lockdown, clinics and hospitals were not operating, doctors were not available, and the fear of me walking into healthcare premises, potentially contract a disease which I don't have. So that itself got the intent thing cleared up. Another big change that happened in the first few months of COVID itself was the government of India formalizing and legalizing video consultations. Before that, it was sort of a gray area. It
Okay.
wasn't absolutely a no, but to prescribe a lot of medicine categories, a patient and doctor should have physically met. They couldn't prescribe you like antibiotics or any other such couple of schedule of those drugs could not be prescribed without a physical meeting. And certain state medical councils were kind of quite vocally against video consultations, and we were trying to lobby our way to sort of formalize it, but it wasn't moving at a fast enough pace. COVID changed that completely. I think that when that announcement happened from the government of India that this is now legal, uh, here is a compliance framework that we have created. If a platform does ABC, they're fully compliant. This is how they will validate the doctors who can offer this, because there's a big fear of quacks coming and doing this. So it's an onus is on the platform to make sure we only let qualified physicians come on board and process. So we built processes around that and validating that and recording evidence that we could show to the government that these are the doctors who practice telemedicine on our platform. So all that happened. But what it really unlocked, the legalization unlocked the uh, providers' acceptance to this. The doctors themselves also weren't very keen on joining a video platform before that, any online platform. But that changed completely. So we got a massive boost of supply, and the consumer demand was anyway there. That meeting happened, and then the marketplace thrives in an atmosphere like that, where enough doctors want to offer their service, enough consumers are looking. So just to look at the entire industry, it easily grew between 20x to 50x in those 2 years
That's huge.
from what it was. That's huge. Absolutely. It was like a hockey stick moment, like you said earlier. So it completely changed. And a couple of platforms, we were very happy that many other companies joined hands. And we had the likes of even companies like Apollo coming in, offering teleconsult as their focus service. Back then, Practo as well. And there were many companies who were able to do this. Everyone's challenges back then was, how can I have enough doctors on my platform to be able to service all these patients who are coming in throughout. And in COVID, uh, of course, a majority of the consultations were COVID related, but because people were in lockdown, they were coming for all other categories as well. They weren't just coming for COVID, because even a gynecology ailment, even a pediatric ailment, people were just afraid of going out. So we needed not just general physicians or COVID specialists, we needed everything, all specialty of doctors, dermatology conditions, everything was being diagnosed and written prescriptions for on the internet. Of course, when the wave sort of subsided, the demand has come down. The market isn't as large, but it's substantially larger than what it was pre-COVID. The spike has sort of gone away, but the new base is at least 10 times of what it used to be. The entire market has at least sustained that 10x growth, and it's growing from there onwards. Again, now organic growth. So, what behavior we see in consumers right now? For the ailments which we categorize as those minor ailments, the first port of call for a lot of digital savvy households has become online. For those cold, headache, and those maybe a stomach infection and all of those categories, right? A lot of them go to a GP on the internet, get prescribed, and some of those then get triaged to saying, okay, this is serious enough, you may require a visit or you may require a test. Otherwise, here is a prescription, and you could. So that behavior has changed. So for those early smaller ailments, we see a big share of that going onto video consultations.
So it's very interesting, and a natural question which occurs to me, like two questions rather. One is, like, I mean, so there was a big jump, and then, as you described, there is a sort of fall from that, but still it's 10x more than what it was. So it definitely has expanded the market for sure, right? Um, Now then, and you also make a point that there is increase in number of people coming into using the service. So there is this growth of the market which is kind of happening. The big question which comes to my mind is, where is this growth coming from? Like, is there a demographic from where this is originating? Is there a are there is it a city centric phenomena? Is it, can we say that It has influence from players like Zepto and others, where the consumers have been, or Swiggy's of the world, where it is, things have changed for them. Is that the consumer you see here more? Like, what is that? Whatever, love to learn what you have observed or
Sure.
seen in that data.
Sure. So we do look at the market with the lens of first internet penetration, and then we look at e-commerce penetration. That usually is the category that comes first in a household. Of when people start to spend money on the internet, e-commerce is the one where they start. And then within that, we realize people who onboard or use healthcare services on the internet. So it's a funnel from there. Total internet consumers, and then some of them, or maybe I think we have about 200 million sort of e-commerce users, and a slice of that is what is heavy healthcare users. And within that, three categories primarily. Pharmacy is one big category. Then comes diagnostics at home, which also was a big trigger event during COVID because everyone got their rapid test done on the internet. So that also category has grown quite a bit. And then these doctor appointments and doctor consultations, which is where we play mostly. So that is mostly in I would say the top 20 cities is where we see most of our consumers coming from. And again, this changed 3-4 years back. It was maybe the top 6 cities doing the majority, but that's grown substantially. The next 15 cities have now contributed and growing faster than the metro cities are growing actually. So it's good growth there.
And do you see an age as a factor of how, like, is that, does that also play a big role in how this is playing out, or the demand is more centered on, let's say, 30 or less, or 40 or less, or like, is there a
Right,
factor?
25 onwards is a typical consumer that persona that we see majority on an application. It's quite in a lot of households is the woman of the house who's the decision maker for most healthcare things. For us, our primary consumer often becomes the woman of the house,
Very
and they
interesting.
manage healthcare for their entire family.
Very interesting. This is very interesting. So this kind of, uh, now, from a patient experience standpoint, I I would imagine, given the experience they have on mobile app for other services, their expectation on experience would be very similar at the doorstep, on the phone, things happening. So, are there major experience ideas, which you are seeing have come in last, or which you all are working on, or have seen as a need by the market, um, which you see patients. So it'll do one of the two things. One, it'll make the patient more sticky, with consumers more sticky with the service, and B, it'll actually expand the market, like, meaning, new people will come in. So are there those ideas that relates to experience, which you have seen, or which you all are working on, or have seen others working on?
Sure. So, I mean, the couple of them come to mind, but maybe one I could cite an example on. We've tried a couple of models on teleconsultation itself. Our original, so typically, if you were about to go visit a doctor, right, you will first decide on the doctor and the place at which they work, and then decide a time and date based on their availability and whatever matches yourself. So it's a scheduled appointment that typically is the format to go get a medical opinion. So we launched a teleconsultation platform with that mindset right in the beginning, where you could schedule something and it will happen at a certain predefined date and time. We saw certain adoption and certain conversion. If 100 people were about to come, let's say X of them go and finally pay money for this future consultation to happen. We tried our hands with something what we now call instant consultation. So instant consultation is you tell me your area of ailment, and then in the next 60 seconds, we're going to put a doctor who can treat that right in front of you on your video call. Right? That completely changed our conversion funnels, absolutely. And the value that patients saw in that, right? Because it was a nagging problem that they had. And instant gratified medical opinion from a qualified doctor that somebody is already vetted for them was just invaluable. So our core product on video consultation right now is an instant consultation product, which is very different from what a couple of other platforms have taken in the market. Some of them are still doing scheduled consult, which has its own value, but there was a big market need for this. So we do both, but a lion's share of that is instant consultation. That's one patient experience thing which was never possible without mobile internet. There was no way that on a Sunday night at even 2 a.m. and your kid has a problem. Right now, you could open the Practo app and find a doctor at 2 a.m., a pediatrician who could do consultation, and it could be here is a preventive a treatment approach you could take, or here's a medicine you could take, or you this is serious enough and you probably go ahead to an ER. All of that triaging coming from a medical expert is great. So that's one example I can say in where consumer demand has completely changed on that, right? It's instant gratification. But apart from that, I think truly in healthcare, what we've seen, the three axes through which we look at healthcare delivery, right? It's quality, convenience, and affordability, and all three. I mean, one has to compromise on one of them to get the other two. Usually, quality is over-indexed over everything else. So, in any consumer insights, in any consumer interviews, in any experiments you have done, right, that trumps everything. No one wants a sub quality and better affordability. Of course, there's always a balance, but in how people value it in their mind, quality is top. So we've also built our products completely around that. And how do we validate quality? We validate quality with other social proof that other patients who have been to their doctor, what have they shared, what are their experiences been, and we transparently tell the consumer that this is a qualified doctor, this is the amount of years of experience they have, this is where they got educated with years and colleges written out. So there was a big, I would say, data gap. There was just a gap of symmetric data not being available. If you were comparing five doctors across five different hospitals, right, you just wouldn't have common data points to compare them. That's the first problem we solved, and we think that is attacking the quality problem of healthcare. You're making a sound choice given enough data, and then you're able to choose where and who to go to. And then comes convenience in that order. Second is convenience, and convenience is examples that I gave where instantly getting a consultation or getting a consultation at a confirmed time. You can walk in at 7 p.m. and you will be seen at 7 p.m. by the same doctor you chose online. So even for a
Is that
booking problem,
is that real? Is that still real in India?
it's I mean, within a margin of 30 minutes, it's quite real. We deliver a 30-minute wait time in thousands of locations in the country.
This is huge.
And yeah, so that has been one of the core problems we've been attacking with the whole doctor booking product. That's one of the main metrics that our team tracks is doctors showing up and showing up on time.
But
I think
without
that's
referring to any place particular, what part of India, this 30-minute can be more, and what part it is less?
Bangalore does the best.
Okay.
By far, Bangalore does the best.
You
Yeah,
don't want to go to
except the
that
travel delays.
side. No,
So
you're
people
right.
are
I mean,
far more punctual there.
yeah,
Far more punctual there.
it's a hard problem because it's not a problem which you can necessarily solve. It's a very cultural situation as
Right.
well. But yeah, this is helpful. But even 30 minutes is not bad. I'm sure it can be better. In many places it is worse. There are lines like I have recall of when I was young going with I'm sure you would have too, with your elders. There was like you would sit down for like a 90-minute just
Ours. Right.
hours before somebody can see you. So very interesting. Let me. You talked about regulatory aspect in one of the other questions, that regulation removed the bottlenecks which were there to make it easier for some of this consumers to kind of come in and get the benefit of the teleconsultation to kind of move their lives faster, get to the solution faster for whatever the ailment they have, right? At least the one that can be easily at least treated, or
Yeah.
prescription can be offered, right? So what are the other government initiatives which you have seen the government has taken a note of? And we talked about, love to learn what you think about ABHA, and how have you seen it start, and like how is it evolving, and what role will it play in your view in evolving the patient experience in next 5 years, 10 years?
Sure. Sure. A lot of solutions require technology to happen. In technology being adopted by the provider, by the payer, both of them, and that is, I think, something strategically that the government is very keen about. How do we get more technology adoption? So they've got the whole Ayushman Bharat digital mission that's being started a couple of years back. ABDM is how everyone refers to it. Under that scheme, there are a bunch of sub parts to it. ABHA being a big one there. That at least we think it's going to be a very strategic move of the scale of what UPI has been for financial transactions. So it's going to give every citizen a unique health ID, and that ID is around which all medical interactions will get recorded. If you were to visit a hospital, the visit will start by you again scanning a code which your Abha ID gets attached to the hospital, and whatever medical records, bills they generate will be attached to it, and you have access to them on your own into your health locker from anywhere throughout your life. And any subsequent doctor that you go to in the past can request for them, and once you approve, they can also see what's happened to you in the past. So that strategically is going to be a master stroke as it plays out. It's still in the really early adoption stage. Government is offering a lot of incentives to technology companies and to hospitals and clinics themselves to adopt it. So there are financial incentives, there are technology incentives that are coming in from the government, and but yeah, we are in the phase where it's still growing slowly. The adoption is still in the stage, but we think in the coming few quarters or maybe in a coming year or so, there's going to be a very rapid growth once it's beyond a tipping point where people start really talking about it on many hospital visits, right? It will just take off. It'll be weird to not have it anymore. Just like with UPI, you don't expect a vendor to not have it anymore. I think we're just a few years away from that.
I see. So this is very interesting. So basically, there's a concept like Aadhaar, which will be there, and so if we were to just take do a little mental exercise to see how this will rapidly evolve, like rapidly adopted. It, Patients asking for it is a hard one, right? I don't think patient will suddenly realize that I need this, right? Like that will require some degree. It will help that the government may spend money on advertising to just let people know about existence of this and the benefits of that. But ultimately, the providers may have to kind of step up to say,
Right,
well,
right,
if you
absolutely.
if you register with me, I'll
Give you
have
benefits.
I'll have the ID ready for you. Like, so the ID creation process may be enabled by the providers,
Absolutely.
or maybe the health insurers. They
Sure.
can mandate that unless you have one, we will not insure you, right? Something like that, right? So I think that will drive the adoption at
Adoption.
scale
Absolutely.
for something like this. But I think the fact that anybody can access the health record is also sort of I won't say dangerous, but it has a privacy related question, which I'm sure the architecture
Sure.
will take care of that.
It's all at the core of it. So there is a
Exactly.
concept of a consent system that's been built out. And
Okay.
just like you have a UPI pin to unlock a transaction, there's a similar concept of a consent framework that's built. And other tech companies, platforms like us, can build that layer. So on the Practo app, you can potentially go right now and create your Abha ID. And when any record against that ID is being requested by your future provider, any doctor, you will get a consent notification on the Practo app and you can approve or disapprove it. And you can share portions of your medical history. You can say only this episode of healthcare which related to a maybe a fracture I had 2 years back, only that needs to get shared with this orthopedic that I'm about to go to. So
And
it's very granular.
so this is very interesting. So, and is it fair to say that the information about health of the individual will be mostly prospectively captured, and whatever has happened, like that's not going to show up there? Is that fair to say that?
That is mostly, I think it'll be this time forward. I mean, hospitals could, who have maintained records of their own, a lot of this data is sitting in silos in their own HIS systems and EMR systems at these thousands of locations in the country. Some of that will get uploaded, but it's yet to see how historically back can people go. It will be some investment on their part, and if the incentives are right, because the government right now has incentives on every record being uploaded. So
Okay.
technically, it's profitable for me. If I build a pipeline to upload records, I could upload whatever I have in the history as well.
So, is it possible for you to upload a record? I mean, not possible, but it is possible that some mistakes may happen. That you'll upload a fractured bone record on my health ID.
ID,
That'll be
which did
funny,
not
right?
belong to you. Absolutely, absolutely, yeah. So
So,
one has
so
to be
something,
super careful on those. Some
okay, got
precautions
it.
should be required.
So practically, it looks like mostly it will be the new
Your
encounters,
records going
new
forward.
episodes
After you
get
create your Abha ID and register it, going forward makes the most sense.
makes more sense. So very interesting. So this is very interesting. So now, the other what we cannot sort of skip a question, largely in my mind, on health and AI are being sort of talked a lot, and generally application of AI, right? How do you see it evolve, and the way you are building Practo's business, and the way consumers are, their experience are shaping up in other parts of their, consumer experiences when they interact with e-commerce and other platforms. How what are the low hanging of AI in your view, which you are already seeing and getting adopted, or you're working on, or you've seen others work on? And then, like, what's the kind of, a journey from here? This will happen first, the next step will be so and so, like, A and B is, where is the most impact, right? Maybe there are things which have very high impact but cannot happen today, for example,
Sure,
right? Low impact ones can happen because they're easy to do. So love to learn how you're thinking about it, and what has been your experience around that.
sure. So I think immediately that's applicable to the business today and has a big consumer value proposition we have. So we have this whole engine, which is the matching engine. When a consumer comes to Practo and expresses a need of a provider for a certain ailment, and they tell us which location they are from, we are now supposed to do the best possible match for them. And there's a list of doctors with a certain criteria and a certain order that shows up. That itself is now powered. The algorithm is quite powered by a lot of ML at the back, where we are constantly learning from what's happening in the last couple of months, in the last month, in the last couple of weeks. And there are I mean, 50, 60 parameters that go into the algorithm, and the ML model just keeps auto adjusting the weights against all of them, and we are able to make better and better matches every week. So that itself was something that would take engineers a lot more time in the past. And with automations, it's just much faster. That's an immediate business impact, and I think almost all search engines or all ranking engines are using some of that in some degree. And I mean, Google, who's probably the largest consumer itself, has said massive movements in their search CTRs itself based on this. So that's was a very obvious one that we could start with. Another thing that we've been toying around with and playing around and doing experiments with is how could we reduce the time that a doctor spends in doing data collection work to complete your medical appointment. So there is a bunch of history taking, there is a bunch of sort of a triaging questionnaire that one has to go through before I mean, that's taught to a doctor as they join college, right? So you ask your previous history, and if the history has X, then the subsequent question is Y, and Z decision tree, which is quite codifiable. And having done that, right, the easiest place to put it is in front of a doctor, so that he never misses a note there. He's able to complete the history in the right fashion, ask the most relevant questions, and the AI models are able to even tell them what is the most probable diagnosis that's there. And of course, it's up to the doctor to decide whether to agree or not. So what's that called is a decision support system, and it's an evolved product category of its own. And some of these already exist as products you can buy off the shelf as well. But that's something that we see very quickly will become a tool in the doctor's arsenal very easily. So he not just has medical records of your past, but he also has a decision support system, which is now able to overlay what happened in this meeting, what has happened with you in the past, and then able to tell you what is the probable diagnosis. And the doctor can choose to use it, not use it, add to it, but he won't miss the obvious.
But tell me one thing. I mean, on this, on the decision support part, I think the fact that the technology is available at least at some places, and maybe used in few areas already. I'll just kind of focus on India for a moment,
Sure.
and the population here, and the cost of technology. Do you see that kind of technology would be a good percentage of the appointment cost today, and will it be affordable by people, or
Sure.
where do you see that math coming in?
Sure. See, for platforms like us, when we deliver, let's say, a video consultation, the largest chunk of that cost to us is the fee of the doctor itself. And if the doctor could be made more productive, it would lower the cost for everybody in the market. The service itself will get cheaper, right? How many consultations could a doctor do in a day? That could potentially go up if we have a decision support system. We would probably spend less and lesser time trying to get the answer which the AI could get much faster. So that itself is one key which could lower costs.
Fee kahan kam hogi? Fee will not come down, right? Like, I don't think anybody will be up for reducing the fee, which
So,
means
sure,
that the consumer will end up paying, even though the doctor's income will increase, but
sure.
the benefit of technology will be only go to the doctor, not to the patient.
So technically, the video consultation fees are already lower than a physical appointment
Okay,
fees in
makes
most
sense.
places.
Makes
That's
sense.
already happened today.
And that because
That's
you
how
are
the
a
market is
platform,
set up.
you have influence on that.
Accumulate demand as well, right? You could
Got
accumulate
it.
demand, and with that scale comes your the key. I mean, the tech cost will make sense if you have enough demand. If you have enough, the problem is large enough, and that tech investment, which is maybe a one-time or a smaller, constant, repeated investment, is actually lower than the operational cost of running that large doctor team. So it
Got
will
it.
make sense for platforms to go invest in this. Of course, on the other side is very high value surgeries, very high value healthcare episodes. Even there, we see a lot of technology adoption happening. So right now, I would say at least 30 locations in Bangalore where we are, you could go get operated with either a robot assisted or a completely robotic surgery. And how these are happening is they make a entire model of the organ which is about to be operated a couple of days in advance and run the whole surgery in simulation on that model, and then the robo goes and operates it. So that it's the other end completely of where AI is coming into healthcare. So there are
And
two
what
extremes. One is a very low cost, low AOV volume one, and the other one is a extreme one. Again, that's also very high cost, but the benefits there are just humongous. The time you take to recover from a non-robotic surgery versus a robotic surgery is like a 2-3x factor lesser. You could walk uh, next day after robotic, let's say a joint replacement surgery, whereas a typical one would keep you on a bed for 2-3 days. So it's dramatically different outcomes. They're coming at a very high cost, but every year we can see the cost coming down.
So this is very interesting. So this also ties with the patient's experience in a different area, which is not the getting into the door, but when you are in the door and kind of getting operated. So so love to learn how. So you see the patient can walk up and go out quickly, right? Which is one, and B, but the cost could be higher because of the way the technology is designed, right? But are there genuine fears among patients you've seen, or it has been proven beyond doubt that certain type of surgeries can just go fully automated or fully robotic, and you will get the outcome you seek in terms of a better quality of experience coming in and going out of the hospital.
Absolutely. So enough studies have already, of course, been done. Enough clinical trials have happened. These are all FDA approved and then Indian government approved ways of treating patients. The real change is coming as the new age of surgeons are adopting them. The surgeons who've been trained now across the world, they go there, they get trained in these equipments, come back, and then set up practices in our country, right? They are now prescribing them as the first option. Like we could treat you with a robotic surgery, and your get back to work is now down to 4 days. You can come here, get operated, 1 day in the hospital, 2 days of rest at home, and 4 days out. Which is I'm talking about a very serious surgery, which typically would have a 15-day downtime. Now that outcome, when coming from a qualified doctor who has done this multiple times, and his convincing is what probably gets the fear out. Of course, there is inventions, but like I think every day we receive at least a couple of dozen queries where patients upfront and ask us where would be the right place to get a robotic surgery done. So
Very
this again
interesting.
was unheard of. Like even a couple of years back, I don't think the awareness itself was there. But right now, it's not just awareness; people are doing research And people ask us questions to the level saying, between robot A and robot B, where can I get robot B? Because I've heard better reviews about that robot.
That's
So
funny.
it's come to that
This
level.
is this is very interesting.
But
No,
it's a
so
tip of the iceberg. I would still say it's a tip of the iceberg. But again, early adopters are the ones that decide what the rest of the market does. And if the top surgeons in the city are prescribing it, you know it's going to work, it's going to stay. And then everybody else is going to adopt as costs come down. It's just that.
so can I ask you a personal tough question? Will you
Sure,
go
sure,
if you have a choice? I mean, I wish and that nothing happens to you ever. But let's say if
sure, sure.
you were to go under the knife, would you like a robot first approach or a human plus robot first approach?
A robot first approach supervised by a great human doctor. So
Okay,
none of them are not supervised. None of them are not supervised. They're
I
all
know,
supervised.
I got it.
But yeah, a robotic approach for sure. I've seen enough proof of that, and it's a science that absolutely works.
Yeah, absolutely. No, I think that was what I was thinking you would say because you have seen this work in practical
Yeah.
scenarios. So this is very very interesting. Now let me ask with medicine I won't say with medicine with hospitals with doctors with healthcare. Generally, there is this thinking at least, and maybe I'm wrong, but I have got sort of come to absorb or have formed an opinion that the adoption of technology is relatively slower as compared to maybe other parts of the market. Um, Maybe it is true to some degree, but love to learn since you are kind of in the words, like in the details of it. What is your observation and how are you seeing the adoption of technology? Because as these providers and all the ecosystem adopts technology, it will have a direct impact on patient experience, right? So there is a direct correlation
Absolutely.
to that, right? So
Absolutely.
how do you see that has changed or is changing, and what role as a practo and you are playing in that driving in that change?
Sure, sure. I mean, no two thoughts about it. It's definitely slower than other industries for sure. And healthcare definitely has been a laggard in adopting tech that you would think is obvious in many other categories. Um, so, 15 years back, if I could go back right in time, we would not even see ERP systems or HIS systems in a lot of establishments. I think that core has got solved. I think that to a large degree, people are using systems. I think majority of the market is using some sort of an ERP to manage like the revenue management cycle of a business. But that is basically an there was a value for that technology. They were getting enough ROI of it, and just managing revenues was itself a problem enough that the investment was worth it. But then that solves some degree of patient experience because at least you're now getting digital bills. Your actually one big lever to that is just increasing insurance adoption. As insurance penetration kept going up, insurances demanded these health establishments to adopt technology because they wouldn't approve bills which were hand generated. They had to be system generated. They had to be codified. They had to be standardized, coming from a pricing catalog with pre-negotiated rates. So insurance got sort of forced the revenue cycle management to become digitized. But so it was a patient lever only. Patients bought insurances, thus this technology adoption had to happen. The second degree I now see is that because of this increasing uh, surge of healthcare services on the internet and the consumers going to the internet, people now need CRM systems. So a lot of hospitals clearly are now adopting CRMs, and now they're struggling with this whole my CRM system does not talk to my ERP system, and can I bridge that gap? So that's again something that I see a lot of hospitals in the last 4 or 5 years trying to work with, trying to find good answers. Sadly, very few out of the box solutions. So it's a painful process that I can see hospitals go through right now. There aren't systems that really smoothly with a couple of integration checkboxes just seamlessly work, where my patient can contact me on my website. My call center can talk to him. He can now visit my OPD through a booked appointment. He can then get like next 1 year of healthcare delivery, and I could see the seamless journey. If I can't see, of course, as a business, I can't show that journey to my patient, to my customer itself. So there are definitely gaps there. The gaps are probably owing to a very fragmented market as of right now. It's a super fragmented market right now, with 100 plus ERP softwares in the hospital space that are operating, and no really large market leaders. So some companies like us can go solve that problem. We could consolidate the market. We could build better integrations. We could actually solve this big gap in a patient's journey, which starts maybe on the internet or maybe with a walk-in, but it's a multi-episode journey. So that stitching is something that I think a lot of hospitals, at least in the phase of solving the problem, they've identified the problem, they're going about solving it. But then tech could do a lot more. It could become a proactive agent on behalf of the hospital, a technology agent on the behalf of the hospital who could engage with the patient, not just in an episode where the patient needs care, but it could be prescriptive, it could be preventive. So that I think is the next level. It's some distance away. Other brands have gone there where they're using technology to engage patients outside a normal episode of a transaction, but that's not happening in healthcare. But I can see people talking about it, envisaging it. Maybe in 10 years, we envision that is where a lot of these will go, where you will maintain like a constant relationship with your healthcare provider. It won't be when I fall sick, I raise a concern, it gets solved, and my episode gets over, and there is now radio silence till the next time I'm sick. That is not how, and tech will really enable providers to be like this, like a coach which keeps you healthy, and of course intervenes when required, but it sort of keeps you on the right track. So with wearables plus right software stack on the provider side, that bridging gap is what we envision will happen. Uh, Lots of way to go, I think, but that again is a trend. It's leading to that trend. Lastly, I would say the one that will really change the game is the government pushing for it, and the government is pushing for that whole regional mission because they want to ensure more and more people under some sort of health coverage, health insurance. And without being digital, it's very difficult because the frauds will just be too much. So the more these records and these financial transactions get digitized, more people can be given insurance cover. The cost of insurance will come down, premiums will come down. So strategically, the government wants to get there. And I think that may be the single strongest incentive in the next 10 years, which will really change this. So it's a good time for a tech company to be there in healthcare space because it's going through that transformation.
I hope some VCs are hearing this, and some companies will get funded in solving one or the other problem which exists in the space. We are trying our bit, in to contribute to finding solutions to to the problems here. And again, as you said, a lot needs to get done. And I think it's the evolving marketplace. So, but it's been a fantastic 50 minutes having you here and having this conversation. I know Shibani will ping me, just to bring up the questions which may be there, so we can sort
Sure.
of go through that in last 10 minutes.
Yes, we got a bunch of questions that came in via our registration page. I'm going to post them here and start picking up a few as well. Oh, there are too many characters. Okay. One of them was, how can we digitize healthcare in a way that reduces human costs?
Sure. So one of the examples I gave was giving a decision support system to doctors, which could potentially bring down costs. Otherwise, something that we've done at Practo right now, we run like a concierge service, which is not a doctor, but it's a healthcare professional who's able to now advise and guide uh, pre-visiting a doctor. So a lot of consumers come with a bunch of anxiety, and through a slightly lesser expense than talking to a doctor, you could get a bunch of question answered. Of course, no medications or nothing, but they could help point you in the right direction. So that itself reduces a lot of cost from maybe going to 5 places. We could give you quotations from 5 places at Practo directly. We could give you the 5 ways in which this surgery or this procedure could be done, and you don't have to spend the time and money to get there. So I think this is a service that we think will broaden and expand. So that's one. But yeah, the decision support system as well is something that will bring down costs. Those are the two things.
Okay, I see Dr. Jitin has posted a question. How to create a patient journey map for smaller clinics?
Sure, sure. So most smaller clinics, I think, are single specialty from our experience. They're not multi-specialty, and then they have sort of a predictable lifetime of what a patient has to go through. So I think a system which can track these longitudinal episodes of a patient really helps. So that's the patient journey. A person could have come for X in the first visit, then maybe a triaging and diagnosis. But if one keeps a record of this and makes sure the right engagement things go from the small clinic to the hospital to the patient at the right times, the patient can be kept in touch. The patient can be asked to come back for follow-up. The patient can be sent. Preventive communication works really great for pediatricians. We've seen patients who come in maybe the first 1 year actually become loyal customers of these doctors over the years, and we've seen technology play a big change in that retention rate itself. So because we could do vaccine reminders, we could do regular health checkups, growth checkups, share a growth chart with your patient through technology, a bunch of those. So in different categories, as I said, it's a very specialty specific problem. Like a dental patient journey will look very different from, let's say, a pediatric journey versus a gynecology journey, which could start maybe pre-pregnancy and then go all the way up to delivery. So I think very it's a great use case to have in which tech can really enhance what a patient goes through. In lieu of the tech, it will be a very different experience, whereas it's going to be very different.
Okay. Now the next question we have, and I'm looking at the time as well. One of them was about gathering feedback. How do we effectively communicate with patients, gather genuine feedback, and show them that we appreciate their efforts in patient care?
Sure, sure. So, I mean, patients do value this feedback. First thing is for us to understand that the new patients who are coming to us are going to value it, use it, and then decide whether to come or not come. And I mean, it's an industry trend that's really happened. Once the value of a feedback is clear, getting the feedback, we do a bunch of our own ways in which we capture this feedback. The We've done two ways. One is at site, where as the patient is about to leave, we capture feedback in the premises itself. It's a small form. We make the patient fill up. How was their experience at registration desk, at the OPD chamber, at let's say pharmacy, diagnosis, whatever. And the question that we end with in saying, would you recommend this establishment to somebody else, your friends and family? So that's a leading question. It's not really an NPS question, but it's indicative of that. We do recommend this to somebody else, and again, break the journey into a couple of legs and ask them to rate. We see very good rates of collection here, uh, but some bias in data, because in the premises, not all the answers are absolutely what one would give if some certain time has passed. The right window we have seen, we now collect feedback about 48 hours after the health episode. That's the window where we see far more unbiased answers, because people have now gone home, probably started the treatment, probably tried to do a follow up, probably thought about the whole episode and compared this with others. So that's a window we capture, and we do multi channel, we do email, WhatsApp, SMS, and keep it uh, from a point of view that the provider you went to is the one seeking this feedback to improve their services, and that has worked well. The messaging is usually in that language.
Okay. Then, how do we best leverage patient data generated both outside and inside the hospital to improve patient care?
Sorry, I didn't get that. How do you?
How do we best leverage patient data both outside and inside the hospital to improve patient care? This
Sure,
question here as well.
sure. Sure. So outside the hospital, I think there are macro trends that one could understand. I'm guessing that is what I could mean by outside the hospital data on what is the most sought out service, how the trends changing, what is in demand in which location, all of that data, if one had access to, could potentially create new services that my patients are needing for, and they're often allied services, right? Like a ortho guy probably wants to go into physiotherapy or maybe rehab and all of that. So that could be outside hospital data that could help. But inside inside the hospital, there is of course bunch of things to collect. One place, if I could divide an establishment into OPD care and IPD care, very different metrics on both. On OPD, it's usually a lot to do with patient experience, time spent at registration, time spent waiting for the OPD to happen. Actually, a very valuable one is time spent in the OPD chamber. I think that is the one that patients absolutely over-index on. If you differentiate from, let's say, 10,000 OPDs, when you ask consumers, did this go well or did this not go well? By far, the ones that go well are the ones where doctors spend long enough time, and long enough time is at least 10 minutes upwards, listening to the patient, understanding, explaining what the treatment pathway is and why is it that. So those are great places. So if one could measure these, right, time spent by the patient in each of these journeys, it will really improve the OPD. And on the IPD, of course, it's far more clinical. It's there's set protocols about what to measure, infection rates, readmission rates, all of that is what an IP is. Again, there are some elements to patient experience there as well. The typical pain point in an admission usually is my discharge window. That's the one everyone complains about all the time. I just takes too much time. I have been allowed a pass to go home, but I can't. So maybe that's something to operationally improve on. But I think a lot more clinical data when it comes to IP, a lot more medical data is more relevant to improve patient journey during an IP.
Okay, and I'm just circling back to Dr. Jitin here, who has posted another question. What are the steps for doctors to start with digitization for clinic for patient experience?
Sure, sure. Uh, yeah, without being too cheesy, but you could list yourself on Tractor. You could open yourself to consumers able to find you on the internet. You could allow them to be able to video consult with you. I mean, not just Tractor, all other digital platforms. There is the Google listing, the self Google business listing is a great place to start. A lot of consumer journey, we understand, starts on Google, looking for doctors by name, clinics by name, or just clinics of that category in that area. And probably maps and local listing is one of the big places to be. And of course, platforms like Placto, which also make you discovered. That's the online presence and visibility. That added with a software at the clinic, which can retain this database of who's coming to you, what are they coming for, are they coming back. Those two together will be the right one to get. So some software layer at the clinic, along with this online presence. I think that would be the right place to start. But of course, one could do a lot more as a phase 2 and phase 3, but this would be the right place to start.
There's a question which says, is Tracto available in Kerala? I've just said yes without asking you.
Yes, yes, we are, of course, of course.
Okay.
Okay, I see that the clock has struck 5 p.m. So that is the end of our time. But thank you so much, Siddharth, and thank you so much, Nilesh, for a very comprehensive discussion on patient engagement and experience. Please look out for our posts on social media. We will be putting up clips very soon of some of the insights shared here today. So thank you so much, Siddharth. Thank you so much, Nilesh, for giving us your time.
Thank you, Siddharth.
Thank you, Shibani. Thanks, Elias. Thanks. Pleasure talking to you. Bye bye.